Welcome to the Veteran Cancer Talk by the Veteran Cancer Network. I'm your host, Ashton, and today I'm joined by Joseph Zolper, Army veteran and outreach manager at the Road Home program at Rush University Medical Center, where he connects veterans and families to life-changing mental health care. Joseph, welcome.
Thank you for having me, Ashton.
So can you share just a little bit about, yourself, your military, what brought you to serve, and just kind of go ahead and get right into it.
Awesome. Thank you again for having me. It's a pleasure to be on here with you. So in terms of, my military, I guess, journey, you could call it, originally grew up in the suburbs of Chicago. Went to college at Illinois State University, got my degree in education, was planning on being a teacher. And then simultaneously while going through undergrad, I was doing Army ROTC as well. December of 2015, I commissioned as a second lieutenant infantry officer. Shortly after that, I did my time at Benning. And then after that, I went to my duty station, was at Fort Carson, Colorado. Shortly after that, about 2018, is when I deployed to Afghanistan in Operation Freedom Sentinel. And that's where I actually took over my first platoon as a PL, which was an incredible experience. Obviously, there's a lot of highs, but also a lot of lows with that situation. Unfortunately, lost some of my fellow brothers out there, and that's really where my mental health journey, I guess you could describe it as. Shortly after that, we came back in 2019, and then I exited the service due to some back injuries in 2021. Shortly after that, I actually started working for Amazon in operations management, and then that's really where I started to see the creep up of some of my mental health concerns that were, residual from deployment and service. So at my time at Amazon, I became really passionate about supporting the military community, even, after I, hung up the uniform. Started my own employee resource group for the military community at Amazon at the site I was at. That's where I felt that passion of scratching that purpose itch that I had, where I left that back in the military, And although what I was doing with the employee resource group at Amazon was totally, volunteer hours, and I wasn't getting paid for it, and spent a lot of time doing it. I really thought that this is what I want to do for a career, is helping the military community, especially with mental health, considering everything I went through, and some of my fellow brothers and sisters went through as well. So that's how I found myself at Road Home back in the Chicagoland area. It was a blessing. We just had my wife and I had our first son at the time, so it was about time to move back home to Chicago. Working for the Road Home program, which provides, as you know, Ashton, no cost mental health care to veteran service members and their families. So I currently work as the manager of outreach and networking, where my team and I really are tasked with spreading the word about this incredible organization, connecting with folks like you and your audiences to make sure folks get the mental health care that they deserve.
No, I love that. Well, now I do want to touch base on the, on your deployment. So where out in Afghanistan were you at?
So my platoon was actually split. We were attached to some ODAs. So half of my platoon with my platoon sergeant was in Kabul, and then the other half of my platoon, which is where I was at, was right outside Gardez. Talking, I know we're probably going to be talking about exposure here soon. Kabul, I very much remember the first time flying into there during the winter, where everybody's burning the tires to keep warm, and it's just that black smog of clouds just hovering over Kabul. That's where we're at. But I traveled in other areas. Yeah.
Oh my goodness. Talking about the exposure, obviously you're aware of what we do here at the Veteran Cancer Network and the advocacy surrounding toxic exposure. So when you got out of the military, or actually while you were in the military, toxic exposure even on your radar? Did were you aware of some of the health ramifications from that?
So the first time was when we were out in operation. I forget exactly where, and we had to dispose of our defecation. Right, we were stirring burnt shit, and I remember some of my guys out there doing it. I was like, that can't be healthy. They're standing right out there in front of it, and I got in to do it too, and it was. I mean, you can't forget that type of smell, and I imagine that had lasting impacts. And then the second time, which even more so, was when I flew into Kabul to visit my other platoon. I ran on the treadmill for like an hour, did a workout with my platoon sergeant. And then I go back to the shower, my hooch to shower. And in the shower, I blew like a snot rocket. I had to clear my nose. It just felt super stuffed up, and it was completely black. I was like, ooh, this is definitely going to have some long-term exposure risk to me. And then fast forward to the rest of the time in my service, really wasn't talked about much. The next time I really heard about it was the PACT Act, not too long ago. So, yeah, unfortunately, there's just not enough awareness and, action, at least in the time when I was in.
I know when I was out in Iraq and Afghanistan, we had the big water buffaloes that were coming through to be able to give us the potable water, I guess you could say, for our showering. But then we were told to drink out of the water bottles because the water wasn't safe to drink. But as we all know, when you shower, it absorbs, into the skin and everything. So were you told anything about the, water contamination that, we were all bathing with, or was that a problem, when you went through?
No, it absolutely was discussed. Absolutely. I don't think more so over at Kabul because I wasn't there as often with the other half of my platoon, but out in Gardez it was absolutely discussed with us. Same thing with the water bottle. It sounds like exactly the same situation that you just described for us. They talked about it with the water buffalo and then gave us the water bottles, but still the showering was pretty gnarly at times, and definitely my
goodness. Now, moving past, obviously, you got out of the military, you worked with Amazon. Through that, were you ever involved with any VA healthcare or, any registries? I know a lot of people, that served, we were encouraged to register for the burn pit. But when it comes to screening protocols, was that anything that was ever offered to you from the time that you got out or even while you were in the military at all?
Definitely. So I was about to say definitely not in the military, but I'm actually wrong. It was shortly before I got out. One of my company commanders, I think that was when the burn pit registry was starting to catch fire a little bit, no pun intended. And he had encouraged, he walked me through exactly how to sign up for it. Like he did a really good job doing that. I unfortunately was just like, no, I'll take care of that when I can. And then I just totally forgot about it for, years. Mm-hmm. And then, as I transitioned out shortly before the PACT Act, was really, again, catching wind. And it really wasn't discussed during like out processing or when I was getting involved in the VA in the first place. It wasn't really discussed much. When I would go back in for appointments, once the PACT Act actually was up and running, there's folks standing outside, the building, in Colorado where I'd go in for my appointments, trying to get people to sign up. And then, I think that's when I first, signed, the registration to get that started. Even since then, really not much. So yeah, there's still a lot of room to grow.
No, absolutely. Now, do you still keep in contact with anybody that you served with? How is your platoon's health?
Absolutely. Now, I think with most people, it's dwindled over the years. I stay in contact with, that platoon that I deployed with, and then some of the ODAs, some of the gentlemen that we served with on the ODAs that we were deployed with, stay in contact with them as well. In terms of their health, on a mental health side, I've always, said like, hey, everybody, like I have this incredible job. Like I'm in the line of business to get folks like all of you and us help. So I've definitely been there as a support structure for that. And, I know from like their friends and some of the folks that they've served, more and more folks are popping up with these cancer risks and exposure risks. So, beyond, the conversations, you and I have had, Ashton, this has always been something that I've been seeing more and more of, hearing more and more of. Yeah, mostly it's been focused on the mental health side, considering that's my expertise.
No, absolutely. Now, do you have any concerns about your own health and kind of what you're exposed to on, any of the risks, regarding maybe, a few years down the line or, maybe whenever you're older about, developing cancer?
100% I'm concerned. I can't quote the exact, percentage, but the increased risk that the veteran and service member population has for, cancer is alarming. I don't remember the exact numbers of it, but I remember when I heard it, I was like, ooh, that's not good. And I remember telling my wife about it as well. So, it's definitely something that's on my mind. Absolutely. Especially as I'm, aging with every year that, when is something going to, some issues with my esophagus, but I don't think that's necessarily related that I continuously get checked on a yearly basis for cancer. But who knows, maybe it could be influenced by, exposure in the burn pits and everything else, among other things.
Yeah. So, I mean, the American Cancer Society, their numbers that they came out is 1 in 2 men and 1 in 3 women will have cancer within their lifetime. However, depending on what study you look at, It's a third increase of getting cancer if you've served in the military or if you've been exposed to various toxins. So definitely encourage you to continue talking to your provider and seeing if you can get annual screenings, done as well. Obviously, through your own transition out of the military, what did that teach you about some of the challenges that veterans can face when they do come home?
The way I handled my transition was, I would say, part arrogance and part, don't know if there's a word for it, just lack of attention to my own health, those two things. And what I mean by arrogance, when I was applying for jobs, like, or when I was about to start the transition process, there's the skill bridge programs that a lot of the branches offer. And, one of my commanders was like, hey, do you want to take part? I was like, no, I'll figure it out. I'll be good. I'll land on my feet. And come to like a month out from, transitioning out, I was applying to like 50, 100, 150 places, not even hearing back. And this is like right towards the tail end of COVID. So things were still weird in the job market. And I wish I took part in like an internship or something like that. But, luckily I did land on my feet, working with Amazon. It had incredible benefits at the time and, taught me a lot. So definitely arrogance on the occupation side. And in terms of like my health, I was worrying about my family. I was worrying about finances, occupation, do I still get to do the fun stuff that I enjoyed while serving in the military, like hiking and all these other things, hanging out with my friends who were still serving? Am I still going to be able to hang out with them? And my health was literally at the bottom. I didn't even really consider it. I don't even remember how long after getting out did I actually book my first VA appointment. It was definitely over a year, if not even 2 years after. So what this all taught me was, one, not to be so arrogant. If you have resources and help in front of you, use it. And then two is don't put your health on the bottom of the totem pole right out of the gate. Of course, some things take precedent over, others. But your health, in terms of issues or concerns or ailments or injuries, that's not going to wait. It's going to continue to persist, if not get worse. So the longer you put that off, worse things can get.
Now, did you use any military resources after you got out to be able to kind of reconnect with your fellow, service members that you serve with, other veterans, anything like that? Or did you just solely try to do it on your own?
For the most part, I solely tried to do it on my own. I still lived local, right outside Fort Carson. So we didn't move right when I got out, which I think helped a lot. A lot of my friends that I was able to, that I was just hanging out with while wearing the uniform, I could still do it because I was still local. And then, when I got to Amazon, as I mentioned, I felt kind of lonely in terms of like, I wasn't around fellow service members anymore. Kind of felt like I was the odd person out. However, there were some other veterans that worked in the building that I connected pretty quickly with. And that's how we, built that employee resource group to create our own community. And that kind of became our own resource to, build a community and camaraderie around. So if it wasn't for that ERG, sense of community, I think I would have struggled a lot more. So, and through that, we were, creating events where we're inviting other local veteran resources into the building to present, what they can offer the other veteran employees. So that was helpful as well.
That's wonderful. Now, I know you're not a clinician, but you're often the first point of contact whenever it comes to the Road Home program. So what does your outreach role, at RHP actually look like on a day-to-day basis?
Great question. So it depends on the month and the season sometimes. Winter holiday season's pretty low for us, but, things are already starting to kick up for us now. So day-to-day is, getting on the call with my team, figuring out exactly who we need to talk to and where those people are located. So I have a team of 5. One does, marketing and digital strategy. And then I have 4 outreach coordinators, one being a senior who, breaks up the entire country into regions and identifies within those regions where are the locations, rural communities, underserved communities, family members, service members, and other communities within the already small military community that really needs to hear about our services. So playing strategy with that, for example, active duty. How do you even reach out to someone, on an active duty installation to hear about a nonprofit mental health clinic? It's going in cold turkey can be a little bit difficult. So, identifying our foot in the door for, again, for example, active duty, talking to chaplains has been super successful to us. Command teams, getting their buy-in, behavioral health staff members obviously connect with us pretty well. since they speak the same language. So really playing strategy on finding exactly who we're talking to, where they're located, and also like quality conversations as well. We don't want to talk to everybody and everybody. We want to talk to the folks who truly need our services and who would be a good fit for. And then that's really more on the national scale. Locally here in Chicago, we're constantly doing resource fair events, going to meetings, presentations, doing MIL 101 training, which is teaching, civilian population what the military culture is, working with alumni and volunteers internally, a lot of events locally as well. So all, coming to the conclusion of like, hey, we just need to tell people about this incredible program and how we can support.
Now, if I do recall, the outreach team, though, they're predominantly made up of either veterans or family members, correct? Why is that?
Yeah, so we have one Gold Star mother, Modi Lavin. We have 2 Marine Corps vets, Chris Miller and Alejandra Hernandez, and then 3 Army, including me, Matthias Carter and Katia Woods. To your question of why that's so important is we're very often the first time people hear about our organization. And the most crucial part of getting folks, especially in mental health care, is building that trust. Being a veteran or being a military family member already gives us a leg up on that competition in terms of gaining that trust immediately. Very often, if not 99% of the time, if not 100% of the time, we're speaking from our own experiences. I mentioned earlier, I struggled with mental health. That's usually how I lead conversations. Like, hey, I've been in your shoes. Or, if I were in your shoes and I went to a program like this, I'd be 2-3 years ahead in my mental health progress than I am currently. So I think speaking from experience, speaking from, a perspective of understanding the culture of the military and military family perspective is super, critical to gaining that trust up front.
Mm-hmm. No, I love that. Now, from a veteran's perspective, what is the Road Home program? I know you briefly talked about it, at the very beginning, but if you could just explain what the Road Home program is and what do veterans usually need most when they first are reaching out to you or the intake team?
Of course. Yeah, so Road Home is a national nonprofit outpatient mental health clinic for veterans, service members, and their families. Everything we offer is at no cost. We're completely philanthropically funded. We're 11 years, coming up on 11 years in our history, and served thousands of, again, veteran service members and their families over the years. And our program can kind of be branched into 2 separate entities. You have your outpatient program that primarily serves folks from Illinois and Indiana. And then we have our accelerated treatment program that is the national, technically international program, because we'll fly in folks from across the world who are veteran service members and their families to our 2-week in-person accelerated treatment program. And for folks who don't know what an accelerated treatment program, another name for it is an IOP, intensive outpatient program. Essentially what it is, it takes the traditional outpatient model, about 6 months worth of that therapy, and jam-packs into about 2 weeks. And we see incredible results from that. During those 2 weeks, we have individual therapy, group therapy, art therapy, mindfulness, acupuncture, tackle moral injury with our chaplain. And folks are with us for 2 weeks where we house them in basically a dormitory on the Illinois Medical District campus. It's an outpatient, atmosphere. So it's not like you're being, your phone's taken away, you're behind lock and key. It's outpatient. You do the treatment from 8 a.m. to about 4 p.m. and then the afternoon or evening, and the lap over weekend is yours to explore Chicago. On top of both of those different branches, outpatient ATP, we have virtual options for both of those. And the virtual options for the accelerated model we can do in 42, maybe 43 states now under SIPACT. And that's been incredibly helpful, really focusing on like reducing wait times, because sometimes that in-person model, the wait times can build, and that virtual option is super flexible for folks. They could do, 1 session or 2 sessions a day, 10 sessions in total over a 1 week or 2 week period. You can do it before work or before you go in for PT or after PT. It's really flexible based on folks' schedules. In the primary symptoms we're treating are post-traumatic stress disorder. We specialize in military sexual trauma, depression, and anxiety are other ones that we take care of as well. So the referral process, super simple, super easy. You can self-refer. It's easy as that. You go to roadhomeprogram.org, and right on that homepage there's a green little button that says Get Care. You click that, and you just fill out your own intake form, and within 72 business hours, someone from our intake team will reach out and get that started. You can sit down with your own provider, fill it out together, but it's a pretty simple process in order to get started in our program. And so that's
I
usually
love that.
the question is like, do I need insurance? Do I need a provider to refer me? The answer to both of those is no. You can self-refer, and we don't have to take insurance. Again, we're at no cost.
No, it's wonderful. Remember roadhomeprogram.org and go to the Get Care. Now, we know a lot of caregivers often carry a huge amount of weight from what they've experienced with their veteran. But how does the Road Home program support spouses and family members? And also, how often are they the ones actually reaching out first?
So I'll start backwards. Reaching out first, pretty often. Me personally, from an anecdotal standpoint, I've worked resource fairs where you'll see veterans and their spouses with them, and they'll see a sign on our table that says like mental health clinic or something like that, and you'll see from a distance the veteran look and be like, no, I don't want to go there, and the spouse like forces them to walk over to us. The spouse does the talk, and sometimes that does happen, right? Because the spouse sees a lot of the concerns and issues that sometimes the veterans and service members aren't comfortable talking about, or there's that stigma behind it. So very often does the family members get the conversation started. In terms of what we support family members and caregivers, I'm super thankful that this program is doing more and more as years go on for the family members, because they're an absolutely underserved community within the military community itself. So going back to those two branches of programs, for our outpatient program for Illinois and Indiana residents, we actually do quite a bit for family members and adolescents as well, so your children too. That's couples therapy, family counseling. We can do, we have group sessions, support groups, again, a lot of, child therapy for adolescents as well. And then we also have recently, over the past year and a half, done more for that in-person accelerated model for family members. So what we've done, about a year and a half ago, we started our own specialized cohort for the family members, and this is for 18 and above family members. So predominantly it's been spouses, but we are actually running, I believe it's our third or fourth one currently right now here in Chicago. And we have a sibling in that cohort, which is really exciting to see that it's going beyond just the military spouses, that parents can come and get this treatment, siblings can get this treatment as well, who are siblings of a service member or veteran. And what that cohort entails, it's the same level of care as what our service members and veterans have historically gotten. Individual therapy, group therapy, the acupuncture, art therapy, moral injury, the whole 9 yards with that. And again, that's for that 2 week in-person option. And we're having a wait list for these cohorts now, and we're doing them once, twice a year, and our wait lists keep growing for the family members, which is it's a good bad sign. It's good that we're able to support the folks, but it's a bad sign that like, hey, we need to create more of these cohorts so we can serve the demand of this type of cohort. So Modi Lavin, our Gold Star mother, senior outreach coordinator on staff, has been super instrumental in, in that program, especially in terms of outreach terms, to get folks to hear about this incredible cohort and get it filled.
No, that's wonderful. I love that you guys are actually incorporating the family aspect as well, because it's too often that we see veterans that are with their spouses, and they're struggling just as much, especially whenever it comes to like divorce rates, among the military population. So kudos to you and the team.
There's one other thing I want to mention about that is beyond like the special things we're doing for the family members for their own mental health. And to clarify, the reason why they're coming to get treatment does not have to do with military service at all. It's just about, it could be their childhood trauma, it could be something they've experienced that does not connect to their spouse who serves or has served. And then another thing is when that service member or veteran are doing their 2 week in-person option, we do offer on the second week for a family member, a spouse, to basically phone in, Zoom in, so they can receive some psychoeducation to learn what their veteran or service member is going through during our treatment. So by the time that veteran or service member comes home, they know exactly what they went through in terms of our 2 week program, can identify signs and symptoms, can keep those folks accountable to continue to improve on their mental health.
For the family members that are interested, in reaching out, does their veteran have to participate at the Road Home program, or could they themselves reach out and get care without them?
Incredible question. They do not have to have the veteran or service member go through our program first. They can just come on their own. They could be the first contact, amongst their family with Road Home. So it's pretty simple in that way as well.
Now, for us, for the Veteran Cancer Network, obviously we focus predominantly on early detection and access to care, but we also know that when it comes to cancer or any type of long-term healthcare issues, mental health will play a huge role in long-term outcomes. So from your perspective, why does having mental health support in place matter when veterans are facing, major medical issues?
That's a great question. I think the easiest answer is, going through something like cancer, not that I've, gone through it personally, but, it's a stressful experience beyond the obvious on your body, but on your mind as well. And like I said, when I was transitioning out, I cared about my health concerns were at the bottom of my totem pole. And I imagine it's probably somewhat similar when you're going through a cancer diagnosis or treatment. Your mental health is probably what you're not worried about because of what you're going through physically. So I think, being in, stable, healthy, health of mind is super crucial in that process, in that treatment. To keep your spirits up, to keep your family close by, to keep yourself stable when you hopefully exit treatment. Your mental health still may be damaged from the experience and trauma you went through treatments. I think getting connected to a program like Road Home or another mental health clinic is super crucial in that process. So you're looking at both of those factors, both physical and mental.
Now, I've been talking to quite a few veterans and caregivers and obviously gathering stories and resources along the way. And one of the things that I actually notice is the high divorce rate. Obviously, in the veteran community, we already know that. But if you, put in something like post-traumatic stress or cancer or any of those other things, it tends to compound the issue. But what I've actually seen is those that are going through cancer, the divorce rate, I've only talked to a handful of veterans or, their caregivers where they did not get a divorce. They stayed together. It was a very, very small amount. So for that, would the Road Home program be a good resource for somebody going through cancer? Let's just say the family member, because like you mentioned, the veteran is focused on getting physically better. But for the caregiver at that point, they're put on a tremendous amount of, pressure, and sometimes that can be a little too much for them. So would you recommend them reaching out to you, or would there be another resource that you would recommend?
100%. If we can't help them, let's say, they can't come in person for that accelerated model, or they don't live in one of those eligible virtual states for us, we're absolutely going to connect them with another organization that can carry that lift beyond what we can. We're part of a larger network. We work with a clinic out in Boston, home base, Emory Healthcare down in Atlanta, Operation Men out in UCLA. We work within the Cohen's Veteran Network with VAs, with a bunch of other networks, alliances, and partners that work around mental health for the military community, very often the family community. I can't imagine what that experience is like for a family member to worry about their spouse, but also simultaneously taking care of themselves. And that's pretty, it's pretty reflective of what they went through probably during marriage and while serving, right? The focus of the marriage very commonly was not on the spouse. It was on the service member or veteran. So looking after themselves, during their veteran service was not prioritized, and I imagine it's going to be the same if their spouse or family member is going through a cancer diagnosis and treatment. So super crucial to reach out to an organization like us, and if we can help, we can absolutely connect them with another.
Now, I know for us, we talk to anybody and everybody. It doesn't matter if it's a post 9/11 veteran, pre 9/11, their discharge status. As long as they've served, we want to be able to sit there and find resources for them. Where does the Road Home program, fit into that model? Is there specific requirements for them?
Yeah, so on your point, we serve pre and post 9/11, regardless of ability to pay, regardless of VA eligibility, regardless of diagnosis of PTSD, MST, depression or anxiety. We have some exclusionary criteria, right? We're not an inpatient level care, so if someone has a far more complex case or needs that higher level of care, we're going to refer them to maybe an inpatient clinic. We are, only outpatient, so we take those kind of like that accelerated model is like a step in between inpatient and traditional outpatient, right? So we take some folks somewhere in the middle. Some of our we do have exclusionary criteria. Some of those are, you have to have stable housing, mostly for when you come to our program, we want to make sure you return to a stable environment so your mental health can continue to progress. Poorly managed psychosis or mania, unable to perform, activities of daily living, unable to withstand from substances during, the in-person programming. So some of those are our exclusionary criteria, but our acceptance rate are into the mid, sometimes have been high 90s. So we accept nearly everybody. And when we don't accept somebody, it's not a no, it's a not yet. Let's say you're struggling with substance use. Hey, you're not ready a fit for our program yet, but let's get you set up with this substance use clinic or rehab facility to get you squared away on that, and then you can come to us. A lot of the folks that we refer to, like folks double dip. They go, get, help over here and they come to us or vice versa. We serve quite a few folks. And then again, for the virtual care, it's only within those 42, 43 states right now. So that's, another exclusionary criteria. If you do want virtual, we can only do it in a limited amount of states.
But if any veteran or caregiver reaches out to you, it's not going to just be sorry, we can't help you if they, miss that exclusion. Somebody will be able to reach out to them and let them know, and possibly find some resources for them. Or how does that process work if they are excluded?
Yeah, very often our intake team and our clinical providers, when they receive those calls and those questions, they're very well equipped to, hey, we know of this other program that we've sent other folks to. Here's their number. Here's how you do it. We do that warm handoff. But sometimes they don't know that there's a very specific need, and that's when they'll actually reach out to my team, considering we're in the community where we work with a lot of these partner organizations. Like, hey, I have somebody who's looking for a service dog that lives in Kansas in this specific area. What can you do to help them? Sometimes we don't even have those resources in the back of our pocket, but we're going to go ahead and research and try to find one for them. Majority of the time, we're able to connect folks with their specific needs as much as possible to try to do that warm handoff. Considering that's super crucial in this process, we don't want to kick people to the curb. We want to hand them over to another trusted resource.
No, that's wonderful. Now, for the veterans or the caregivers that are listening right now who feels overwhelmed or they don't know where to start, what would you want them to be able to hear? What's your message for them in that moment?
Allow yourself to be the spotlight. I know for a fact from my own experience, my wife, my family took a back seat to my service, and I know that's somehow just how it has to work, when being deployed, when doing long training cycles and you're away from family, the eyes and the focus and the attention is on the service member and veteran sometimes. And sometimes it should be, right? Very often when I've talked to family members, when they have the ability to be the center of attention in terms of their needs, they're still hesitant. And it's because they're not used to it. And there's not a lot of programs out there that provide dedicated mental health services for family members. So, when we first started that in-person cohort, I was so egotistical. I was like, oh, we're going to fill this easy. It's going to be super easy. There's nothing like this out there, really. We're barely going to have to try. And I was totally wrong. I definitely got put in my place. It was like pulling teeth to get that. We got the cohort filled. But the conversations I was having with spouses and family members were like, oh, yeah, I'd consider it. There was just a lot of hesitation. And beyond the logistical needs, sometimes, they're caregivers. They can't leave the house for 2 weeks. They can't, leave their children. They don't have appropriate childcare. So, we've been able to reduce some of those barriers, working with one of our strongest partners, Wounded Warrior Project, to reduce some of those barriers to get family members this care. And then, they kept going back to like, oh, well, I've never really done anything like this. There's a lot of stuff out there for my veteran. There's not a lot of stuff for family members, so I'm a little bit uneasy about this. Yeah, what I would tell them is lean into it. Allow yourself to get the care that you also deserve. You served as well. It's not an easy job being a military spouse or child or family member. Allow yourself to get this level of care.
I love that. Well, Joseph, thank you so much for joining the Veteran Cancer Talk. We appreciate your time, your expertise, and again, thank you for your service and everything that you're doing to help the veteran community.
Oh, no, thank you, Ashton. It's a pleasure to be here with y'all, and love what y'all are doing, and wish you the best of luck.
Thank you.